Closamectin, the only 4-in-1 product licensed for treatment of worms, internal and external parasites, together with adult and immature fluke. Advanced fluke treatment, a major breakthrough in parasite control. No other injectable fluke and worm preparation works earlier against adult and immature fluke in cattle. Closamectin breaks the reproductive cycle of fluke by interfering with the growth and reproductive development of immature fluke. Closamectin is presented in a unique heat-generating pack. The unique heat release system delivers the following benefits. Administration at body temperature, therefore reducing pain and trauma at the injection site. Improved syringeability, all leading to easier administration and less discomfort for the animal.
Before using Closamectin, you have to activate the heat pack that is included within the packaging. So the top is unscrewed, the little click device is isolated and clicked to start the heat pack working, then screw the top back on again and shake thoroughly to make sure that the liquid and the heat are getting as much contact as possible. It takes about 15 minutes for the heat to be maximised, so if it's shaken a few times thoroughly within that 15 minutes, then that makes best use of the heat pack within the device.
A powered dosing injector can also be used to make really light work of treating large numbers of livestock. But to start with, let's have a closer look at the liver fluke and why it causes so many problems.
The basic life cycle of liver fluke is that the adults live in bile ducts of cattle or sheep mainly, and they reproduce there, and the eggs that they pass go down the bile ducts into the intestine and out onto the grass. Once the temperature reaches 10 centigrade, the eggs hatch into myricidia, which swim because they need water. It needs to be raining when they do this, or a film of moisture, to reach a snail. They burrow into the foot of the snail and develop in the snail for 6 to 9 weeks, depending on the temperature. At the end of that, they burst out of the snail. Again, it's usually in wet weather, swim, attach themselves to the nearest grass or vegetation. And they sit there for up to a year, although most of them will get tramped down into the mat of the herbage over the following winter. If cattle or sheep or any animal comes along and eats the grass with these metacercaria attached to it, there's metacercaria, go down into the stomach of the animal, come off, burrow through the wall of the intestine, make their way to the liver, burrow into the liver, and then burrow through the liver for about 6 weeks to 8 weeks, 6 weeks sheep, 8 weeks and so in cattle, into the bile duct, and the whole cycle starts again. Liver fluke incidence has increased dramatically over the last 20 years. The reasons are a bit obscure, but global warming may have something to do with it because of increased rainfall. Also, as a result of some better summers, cattle are kept out longer on areas that normally would be wet, and if fluke has developed on them, they pick it up there. There's been some research in New Zealand that has pointed out that for every degree rise in the temperature of 1 centigrade, the number of metacercaria increases by about 200%. The incidence has increased by 160%. It has also increased in areas, for instance in East Anglia in England, where it hasn't been seen before. It has risen dramatically. In England it's about 46% in dairy cattle, in Wales it's over 80%, and in Ireland it's probably in 50%. The only treatment really is drug treatment at the present minute, and to try and keep animals away from fluke habitats is extremely difficult because you get animals like rabbits and hares and even rats, which also transmit it, passing it even to the areas where you keep cattle from. There is resistance, especially to triclobendazole, which has been increasing over the last 10 years. The exact amount of resistance is not known, but it's certainly, people are aware of it. There's less resistance to some of the other drugs at the present minute.
Closamectin is an injectable form of anthelmintic which contains two active drugs, ivermectin and closantel. Ivermectin is there as a wormer and closantel is there as a flucicide. The combination of drugs within closamectin having the wormer and the flucicide means that both worm and fluke can be treated at the same time, and containing closantel as a flucicide makes it a very, very effective combination.
Closamectin contains a unique patented combination of ivermectin and closantel. The unique formulation in closamectin increases initial ivermectin blood levels, which improves efficacy when compared to ivermectin alone. Closamectin kills over 99% of Couperia and 99.9% of Ostatagia. These are key parasites of parasitic gastroenteritis. Lungworm are similarly controlled together with external parasites such as blood-sucking lice. But how does closamectin work on fluke? Owing to its specific mode of action, closantel is fast-acting, killing fluke within 48 hours, and has a residual activity for at least 42 days. That's 6 weeks following treatment. This means that early immature fluke which survive paralysis are stunted and don't inflict the level of damage caused to the liver tissue by a rapidly growing and burrowing fluke. This is in addition to a high-level kill of immature fluke above 7 weeks. It's important to control fluke at this early stage before migration through the liver to the bile ducts, which can cause irreversible damage, and before the flukes reach egg-laying capacity at 10 to 12 weeks. Closamectin is the only combination injectable that targets adult, late immature and early immature fluke. Only closamectin will kill over 99% of adult fluke at 12 weeks, kill over 90% of late immature fluke at 9 weeks, kill over 90% of immature fluke at 7 weeks, and have a stunting effect on early immature fluke at 5 weeks that not only delays but significantly reduces egg laying. Closantel has also been shown to reduce egg laying for up to 13 weeks. Closamectin ticks all the boxes.
At turnout, when the cattle start to graze, as soon as they're turned out, then they can start to pick up infective Metacercariae from the grass. Now, closantel within closamectin will treat the immature fluke from 7 weeks and above to greater than 90%. So incorporation of closamectin within the spring routine, say 8 or 10 weeks post-turnout, will mean that the fluke can be very effectively treated and worms can be treated at the same time. Once they're at grass, then treatment 8 to 10 weeks post-turnout is ideal to control the fluke and also as part of the, whether it be a 3, 8, 13 week worming regime. So closamectin can be incorporated in about the 8-week stage as part of that, and then that will greatly reduce the fluke infestation on the pasture later in the year and minimise the impact of any fluke picked up at that stage. The traditional control of fluke would be very much focused on once yearly usage at housing to treat the cattle for fluke when they're housed. By doing this, the year-on-year increase in fluke is not being controlled at all, and twice yearly treatment of fluke with a spring treatment has been greatly shown to reduce the numbers of fluke present on the pasture later in the year and have a knock-on effect in actually starting to control the level of fluke infestation.
Cattle can be treated the day they are housed. Delaying treatment until fluke reach the adult stage can reduce growth potential during the early housing period. The greatest reductions in live weight gain occur in the early stages of liver fluke infestation, emphasising the need for early intervention. Closamectin is the ideal treatment for all bought-in stock before mixing with the herd. Each adult fluke is capable of producing 50,000 eggs per day, so even low levels of infection in bought-in cattle can very rapidly contaminate previously uninfected pasture. In dairy cattle, fluke infection can lead to liver damage with reduced milk yield and lower milk quality, fertility problems and metabolic disease. Provided there is a dry period of 60 days or more, Closamectin can be administered at drying off to treat fluke and optimise liver function prior to calving and the high metabolic stress period of early lactation. So in summary, what are you getting? Protection from adult and immature fluke, worms and sucking lice. Closamectin, the most advanced injectable fluke and worm treatment for cattle. Utilising 21st century technology at its best. From the pack, to the product, to the animal. Closamectin, the new way to cleaner pasture, improve growth rates, improve milk yields, improve fertility, giving you a healthy herd.